Good morning, everyone, and welcome back to Instagram Live with Intimate Rose. I'm Dr. Amanda, and today I'm going to be joined by Dr. Heather Quaile. She is a specialist in menopause. She's certified by the Menopause Society, and today she's going to be educating us about GLP-1s. She's a weight loss specialist as well, and she's just got a wealth of knowledge that she's going to be sharing with us today. And we'll be talking about what GLP-1s are, who they're for, and hello, good morning. And we'll be going through what are some things to be aware of. And I have a code to share. So additionally, if you have any questions about GLP-1s and weight loss, comment ready on this video. Good morning, Heather.
Good morning. Thanks for having me.
Thank you for joining us on this Monday morning.
Absolutely. Absolutely. How are you doing?
Very well. How about you?
Good. Good.
Good. Well, I was just telling everyone that you are an amazing expert in the menopause space, and you're also very knowledgeable in medical weight loss. And today our topic is GLP-1s.
Yay. Awesome. I'm excited to be here.
Wonderful. So can you start by telling us what is a GLP-1?
Yes, absolutely. So GLP-1 stands for a glucagon-like peptide. And basically kind of what it is it's almost like a peptide or a hormone that is naturally produced in our own body, helps to regulate blood sugar, our appetite, our digestion. It's produced in the gut. That's kind of our natural GLP. And it gets released when food is eaten. So it helps again control like stabilizing blood sugars. It stimulates insulin release as well as kind of inhibiting that glucagon secretion as well.
So when it comes to people that are using this medically, what's its role in the weight loss
Yes.
realm?
So basically, let's kind of go back a little bit. So this medication was actually initially created for diabetic patients. And so sometimes I get these weight loss patients that are like, oh my gosh, I'm so scared of the medication. It's only been out for a short time, which actually is really false. We've had a lot of GLPs back in the day, probably 10, 15 years that we've been using them with a lot of good longitudinal data that existed on them. So they were used for type 2 diabetics. And what they did is they helped with blood sugar control for the type 2 diabetic. And what they found with these GLP peptides is that they were having stabilization of their blood sugars, but on average, patients were losing anywhere between 5 to 10% or greater of their body weight after the first year of use. And so, of course, the company's like, oh, we've got to dive into this weight loss with GLPs. And then all of a sudden, once they started seeing when semaglutide is the actual GLP, but in the branded name Ozempic that was used for diabetics, what they were seeing on that is this greater than 10% of body weight after the first year. So again, that company really capitalized on this GLP craze and then created it for weight loss, with Wegovy being that first drug for weight loss.
Oh, interesting. It feels like it's only been around for a year, but as you're saying, it's been 10 to 15
It's
years
been
since.
a long time. I'm actually trying, as we're sitting here, I'm going to look up first one. GLP peptide is I want to say it was called Byetta, Byetta. It was exenatide, and we used it for diabetic patients, and it was released in 2005. So
Oh,
I'm mistaken in telling you 15 years. It's actually been like 20 years was the first one. And then there were other ones that came out like Victoza, and then Victoza kind of turned into this Saxenda. So like I said, it's been around for quite a bit of time.
so interesting. And so now that it's been sort of opened up more broadly beyond just patients who have that type 2 diabetes, who might be a good candidate to use the medication?
So still a wonderful medication for type 2 diabetics. Another place, of course, for weight loss. So when we use these peptides, they have an obesity index. Unfortunately, part of the problem is we don't look at obesity as like this chronic condition, which really it needs to be looked at as more of a chronic disease. state instead of just a vanity thing. So it's great for the patient that has a BMI at 30 or greater. And so that's going to kind of fall you on that obesity index. But if you have a BMI of 27, which is going to put you in an overweight category, and you have other comorbidities such as elevated cholesterol or elevated blood sugar, excuse me, or elevated blood pressure, hypertension, then it could be a really great option as well for patients. And then there's, of course, the ways that we use it kind of off label. Really great for the patient that may have polycystic ovary syndrome and is very insulin resistant, metabolic syndrome. I use it quite a bit in my menopausal patients. And then it also now has a brand new indication for sleep apnea. So that's kind of really exciting too. And there is some really cool data, which I know you talk a lot about pelvic pain and endometriosis. There actually is some new data that's coming out on GLPs and their use for endometriosis, which is super exciting.
Wow. What are some of the symptoms of endometriosis that is showing
The data
keep
is
going?
so new. I've read like 2 or 3 studies with it, so I don't even want to talk on it yet because it's such a new but honestly, I can't even speak educated to it yet. But they're saying that there are some things. Hold on, I'm reading what it says. It could have some we know it has anti-inflammatory properties, so they're thinking with that and maybe some anti-fibrotic effects. So again, like so cutting edge new. I've read about it probably within the last month and a half. And then of
Wow.
course,
And PCOS.
and then of course we have it for alcohol. There's looking at it for alcohol and smoking cessation too.
Interesting. And I was actually just going to touch on that and ask you a question because one of a piece of feedback that I received from a patient who was using GLP-1s is that it seemed to calm the mental internal chatter. And she noticed a significant reduction in her anxiety while she was on the medication. What's happening with that? Is that a
So
thing?
So we are more studies are needed, but we know that it's working on the dopamine receptors in the brain. So when you think about food and hunger cravings and all that chatter, a lot of times it's regulated by that neurotransmitter dopamine. It's those hits that keep saying like you're hungry, and then it's also that ghrelin and leptin that kind of come in the mix as well too. But what they're finding is that with that calming of that hunger chatter, there's more data that needs to be done, but it's working on those dopamine receptors. So it's kind of causing that like calming, sedating, getting rid of that hunger chatter that's there. It's also the big reason why I ask my patients when I put them on it, we're always going to check on their mental health status because some people, as it starts to lower the dopamine, it could have some effects where it may lead to some depression, maybe some anxiety. So that's why, again, these doc in the box shops where you can just go and get this med, or people are using research product med that are off label and all the things, like it's really scary because there are side effects that come with this drug and there are potential issues with like depression and anxiety, and it's why you really should be going to a qualified provider who kind of is really knowledgeable in the GLP space.
That's really good feedback. And we had a question. I'm going to scroll up here. Um, yes. A physical therapy practice is saying, good to hear positive feedback about GLP from specialists. Too much of conflicting
Yeah,
information.
there's a lot of it. And like I said, there's a lot of these big companies that are just having tons of telehealth that's available to people, where you're just like, hey, I'm going to go in and just go get a GLP, shoot myself up. Like I get really frustrated when I have patients that may come in and they're just like, I just want to take the shot, but I don't want to do the lifestyle changes and implement all the things. So I'm really kind of big on this holistic approach. I draw blood, I work on lifestyle change because it's more than just shooting yourself with a med and moving on your day.
Absolutely. And that brings me to my next question. How is it administered? How often? What is it? Is the dose specific to the patient? What does that look like in terms of how it's
Yeah.
consumed?
So in my practice, yes, it's very dose specific. So with my patients, they come in for their initial visit. We have a body composition scale, a really big scale that tells us like their skeletal muscle mass, percentage of body fat, percentage of body water, all those different things. And part of the reason I'm really a big stickler on skeletal muscle mass is because with these drugs, you're finding that we are losing a significant amount of weight, on average between a half to 1.5 pounds a week. So as you're losing that weight, of course, you're going to lose skeletal muscle mass. So it's really important to stay ahead of the game with just making sure that you're exercising, you're doing your heavy weightlifting and all the things with that. But it's a once a week injectable. The company that produces semaglutide is also, they also have a oral medication that's out there called under the brand name Rybelsus. Um, and that's a daily. It has a lot more side effects with it, so I don't love it quite as much. I don't actually really write for it much at all because of the side effects. But it's a weekly injectable. When they come to my office, labs, blood testing, all those things, body composition, and then we see our patients. We initially see them like every couple of weeks just to make sure they're tolerating. It's very dose specific for patients. And then you're really trying to mitigate a lot of the side effects because these meds do cause quite a bit of nausea if they're taken too quickly or moving up the escalation too fast. Some GI changes, constipation, diarrhea, and things, again, why it's so important for people to just go to a qualified healthcare provider.
Sure. From a physical therapy standpoint, loading the muscles and loading the joints is so important. As you mentioned, they can lose that muscle mass. And specifically too, we're thinking about these populations that had inflammatory diseases or are taking it in that perimenopause, menopause state where estrogen levels are declining and we have concerns about bone mass as well. One of the musculoskeletal hacks that is out there is wearing a weighted vest at 5 to 10% of the body weight. I actually just got mine and I went for a walk with it. I run quite a bit, so I'm always loading my tissue, but I went for a walk and holy moly, you can feel it.
You can totally feel it. Like I have a 10-pound weighted vest, and let me tell you, some days I'm just like, oh, maybe I really needed to invest in a 5 to start because I mean, like it's a big deal. If you're normally like this person that goes and walks 3 to 5 miles a day like we do, it's like then adding that weight, it's kind of crazy. I'm a product of GLPs. I've been on mine for about 4 years now, lost quite a significant amount of weight, and I laugh because I'm just like, oh my gosh, you would think carrying a 10-pound weighted vest wouldn't be that big of a deal considering I was carrying around like 60 extra pounds in weight, but like it makes a big difference.
Absolutely it does. And you are such you're just such a great product of information, sharing your story and how you're managing your patients as well. In terms of like longevity, you mentioned 4 years for yourself. Do patients stay on this for years on end? Do they graduate off, or what does that look like?
So unfortunately, the drug company has never come out with a true maintenance dosing. I maintenance dose my patients. I usually will put them in maintenance at least for 6 or 9 months to slowly titrate down. Some people can't titrate down to lower levels. I think the problem becomes that obesity, again, is a chronic condition, and that's really how it should be treated more than looking at as a vanity thing. I mean, it affects blood pressure, it affects your heart, it affects your cholesterol, all the things. Ever since I've been on my GLPs, I've been able to have completely normal cholesterol, blood pressures come down, none of these at risk for pre-diabetes, all the things. My joke, honestly, Amanda, is you will bury me with my GLP and my hormones. I will probably be that patient that's like in my 90s, hopefully never going off of them because it has so many anti-inflammatory properties in the medication. Obviously, mixed with the hormones, there are much greater results in hormone care if we can actually add a GLP to the hormone regimen too.
That is so
And we
interesting.
have data on it. Like there's really good data on GLPs with hormone use.
Is there going to be a movement, do you think, among perimenopause and menopause care to start including both of these? Because we're
I
just
push
now pushing the perimenopause and menopause hormone therapy.
Yeah, I push it a lot on my menopausal patients that need the medication, that it can be really life changing. I'm really hopeful. There are some people, it's so off label, it's so cutting edge, but I'm really hopeful some of the longevity and some of more of the evidence-based people will come out with some more data for us on using it in microdosing, where you don't necessarily need this full major amount of it, but it may be a lot of like small dosing for anti-inflammatory anti-inflammatory benefits. I think the verdict is still out on what this looks like, but I think these drugs are novel. I mean, alcohol, smoking cessation, sleep apnea, obesity, diabetes, Parkinson's disease, endometriosis. I mean, like the list goes on and on. I mean, some of the bigger manufacturers like Eli Lilly have come out with cardiovascular studies. So, I mean, I think peptides are the cutting edge of where we're going to see healthcare going.
So interesting. You just said Parkinson's as
Yep.
well.
Yep.
Wow. That is amazing. If we can start to see some ongoing maintenance care for those people that have those ongoing chronic conditions, that would be
Absolutely.
wonderful. Is there anything else that you would like people to know about
My
GLP-1s?
My biggest thing is to do your research. If you feel like you're a candidate for this, but your doctor won't even consider it, or you don't have health benefits that cover it, compounding is going to be a lot more difficult to get your hands on, but there are still some people that can get it. There's a lot of people that are anti-compounding, but unfortunately, these drugs are so expensive. And so Eli Lilly and Novo Nordisk both have Lilly Direct and Novo Direct where you can get the drugs. It still is running about $500 for a 4-week supply, which is really cost prohibitive for a lot of patients. These meds are in a shortage. It's where compounding, if with the right provider, can be life changing for patients. Like, I'm not talking just call the doc in the box, get the script, and never see them again, and they keep auto filling it for you. But you really need to go to a qualified provider that can kind of work with you. We still do a little bit of compounding on hormones. We think out of the box. It's a little bit frustrating to me being in women's health how many things we say like, oh my gosh, you can't do that, you can't go compounding, it's off label, you can't do it. But we use so many things off label, and we have no great research for women. And on another realm, we don't have certain hormones for women, but that's a whole other day's story. So my big thing is just find a provider that will work with you, that's going to hear your story, that's going to take your blood, and is going to take the time and not just throw you a shot, because they're not for everybody. But they're for a lot of, they work really well for a lot of people.
Wonderful. Well, thank you so much for
Of
joining
course.
us here. And we do have a code for those watching. Our code is Plan50 that gives people $50 off of our program that we have here at Intimate Rose, so they can visit our telehealth section. The patients are screened and really doing due diligence to work with them and meet those goals, especially as you said, if they're not being listened to and they don't have access where their provider is. So Plan50 for $50 off. And thank you so much for your
Yeah,
time and
thank you for having
expertise.
me.
And we'll see you in the fall at Menopause Society.
Yes, yes, absolutely. Thank you so much.
Take care, Heather.
Bye.
Bye.